Medical imaging is the most vital tool we have to reach a diagnosis. Yet, it is not accessible to 2/3 of the world population. You need to get referred to the right specialist, wait and wait and wait for your appointment just to get a diagnosis. Well, we believe ultrasound augmented with artificial intelligence and cloud computing can change all that. And this is where MEDO comes in.
One of the big problems that we all face is arthritis. Everyone's joints wear out as you get older. But there's a group of people whose hips wear out when they're in their 30s. That really bugs me. Like, these people should not be getting arthritis in their 30s and 40s. And this is treatable because as a baby, if you identify that someone has hip dysplasia, then you can treat it by putting a soft harness on the baby for a few weeks, and then it goes away. It's like magic. The treatment works 95% of the time. But if you're not screening for it, you miss it.
So to us was like, why don't we universally screening every baby that is born? It is easy. It's a less than 10-minute scan, harmless. Problem is that you can't send every single baby to radiology department of a hospital. It's not feasible, it's expensive. But imagine if a nurse can just do that when the child is going for vaccination.
The problem with ultrasound is that it is hard to interpret the pictures. It takes a lot of training. So my mission has been to help people in whatever way that we can to make ultrasound more useful. What we started with is taking regular 2D pictures and making them into 3-dimensional images of body parts. If you do that, you can visualize the body better because you can see a whole 3D sweep through it. So what we've done is we've taken some expertise that we have available from the computer science and engineering departments at the university and have been working in partnership to use deep learning or artificial intelligence to better understand those ultrasound images. So MEDO is a startup company that is designed to commercialize these approaches, taking 3-dimensional images of the body with ultrasound and then having a computer look at those pictures to try and figure out what they mean.
We brought novice people who had never ever touched an ultrasound probe in their life. And we teach them for just a couple of hours how to do the scan our way. And then our technology was reading the scan. And we were able to match expert sonographers and expert radiologists that combine expert scanning system with just total novice people who had never ever touched an ultrasound probe.
Right now, patients have to come to the hospital. For example, people will fly from the Northwest Territories at the government's expense for an ultrasound here. What we envision is, well, let's do it the other way around. Let's take the ultrasound imaging to the patient.
Well, 2 of my co-founders are professional radiologists, and they're very excited about that because they know, well, they are in the clinics, they feel the pain, they know what exactly is happening, and they know the way that we're doing things is just not right. It's not efficient, it's not sustainable.
Using this technology should be quite a bit less money per scan, so maybe we can do more of them for the same price. Maybe we can scan every baby for hip dysplasia for the same price of right now what we're scanning some of the people. That would be my vision.